Hey guys, today I'm going to be talking about the 4 best range of motion exercises that you should be doing before knee replacement surgery. One of the most important factors I look at before knee replacement surgery is a person's range of motion. Ideally, you want to start a knee prehab program 6 to 8 weeks before your surgery so that you give yourself enough time to increase your strength and range of motion as much as possible. This will increase the chance that you come out of surgery stronger, faster, and have less complications. This is how you do the passive heel slide. All you need is a belt or a yoga strap like what I'm going to be using. You're going to start off in the same position as if you're doing an active heel slide. And before you get into that position, you want to put the belt or yoga strap around the midfoot of the surgical leg. And then from here, you're primarily going to use your arms to lift that heel up and slide it towards your butt. Your knee is just guiding the direction of the knee so it doesn't shift outwards or shift inwards. So once again, breathe out as you pull that heel towards your butt. Now at some point, you're gonna feel some restriction or some discomfort in the knee. If you don't, just keep going as much as you can. If you feel some discomfort, that's where you stop and you back off. Pull in with the arms, feel some tightness in the knee, and back off. The second exercise is to improve extension or straightening of the knee. And this is called the wall hamstring stretch. The way you do it is you put the ball of the foot against the wall and the heel on the floor. Try to keep the knee straight, and you're going to hip hinge as you lean forward and control the bend with the hands on the wall. The way I describe the hip hinge is pretend someone's karate chopping your hip, so your low back is straight as you lean forward. If you're doing this correctly, you should feel the back of your knee as you lean forward. The next exercise to improve knee range of motion is a standing knee bend. This is a very efficient movement to improve bending of the knee on the front leg and stretch the calf of the back leg. So this is how you do it. You hold on to the wall, and for our purposes, we're doing the left leg. You're going to keep both heels on the floor. You hold on to the wall and you're going to lean forward. You should feel a stretch in the front knee and then also a stretch in the back of my right leg. So stretch in the front of the left knee to help the bend of the left knee, and then the back of the right calf muscle. If you want to make this a little more aggressive, what you can do is use an elevated surface, in my case a stool. You're using the same leg, heels are still on the floor or whatever surface you're stepping on. You hold on to the wall and you're going to lean in to get a little deeper stretch on that front knee. Typically what you want to do is hold this for up to 1 minute at a time, several times a day, as you can tolerate. This is a great exercise to improve all knee bending and straightening, and the best part is you could do it anywhere. So those are the 4 best range of motion exercises that you should be doing before knee replacement surgery. The more you do now, the faster you'll recover from knee replacement surgery, and you'll be able to get back to doing all the things you love as soon as possible. If you have any questions, please comment below and my team will get back to you as soon as possible. Also, if you found this video helpful, please consider subscribing so you don't miss out on our weekly videos. As always, move better, age stronger, and I'll see you on the other side.